Welcome back to Mental Health in Our Community, y'all. I'm Dr. LaWanda Hill here, and I want to talk with you about the difference between anxiety versus stress versus fear, because they are very similar, but there are slight differences, and knowing the difference could let you know if you are meeting the criteria for a clinical disorder referred to as generalized anxiety disorder. So let's talk about fear. Fear is our biological response to an immediate threat. Let's say you're driving down a one-way lane and someone is in the wrong lane and they're driving towards you head on. You will have a biological response to that immediate threat because it's an immediate threat to your safety, your life, and your well-being. That is to be distinguished from stress. Stress is our response to a perceived challenge or demand. Say you're the VP, say you're an executive, say you're a manager, and you have a huge workload. You may have difficulty with an employee that you're supervising. You may have a big presentation coming up and there's a lot riding on it. It is natural to have a stress response to that perceived demand and that challenge. These both are very different from anxiety. When we start talking about anxiety, we start getting into the future. We're getting into future worry. Our brain starts to go into that what if song that it sings. What if it goes wrong? What if it goes bad? What if I'm perceived differently? What if I can't meet the moment? And when we start thinking about future worry, usually we think worst case scenario when we are in that anxiety, okay? When we're talking about why this matters clinically, because when you have stress and when you have fear, once the immediate threat or the challenge or the demand goes away, then it is resolved and there's an ease that comes. But when you have anxiety, specifically clinically anxiety, you begin to feel that worry and experience that worry, and it becomes difficult to control. It's disproportionate, it's difficult to control. And here's the key: it is across context, meaning it's not just about work anymore. It's about work, it's about finances, it's about relationship, it's about parenting, it's about your aging parents. And it doesn't matter what comes up, there's always something that you're going to be worried about, and you have a difficult time controlling that worry. If you have that persistent worry across context that's difficult to control and you experience it for at least 6 months, now you're moving into the category of generalized anxiety disorder, which is a clinical disorder. It's a clinical mental health condition and it requires clinical intervention. I'm going to be talking in the future about different interventions and different tools that can help you manage the anxiety, but it's very important to know the difference. So know the difference between fear, immediate threat, stress, our response to a perceived challenge or demand, but anxiety is about that future worry, and our brain usually tells us it's going to be the worst case scenario.